I'm going to talk about Medicare Part B. I'll show you what it covers and I'll show you what it costs. And it's certainly important to understand because we don't all pay the same for Medicare Part B. So stay tuned. Okay, more parts of Medicare. So we have a number of different parts of Medicare that we need to understand. This one I'm going to talk about Part B, which is a big part of Medicare. So we certainly need to understand how it functions and how much we're supposed to pay for Part B. So we actually have to pay to have our Part B, but it's important to have. So we need to understand it completely. So when we talk about the parts of Medicare, we're talking about Part A, Part B, Part C, Part D, and then throw in the extra little piece in there, Medicare supplements, otherwise known as Medigap coverage. So it's important to understand all these parts, and you may have just watched the video that I just did on Part A, so certainly important to understand that. Part A is about half of Medicare, Part B is about the other half of Medicare, so we need to understand exactly how they function. So on this video, we're going to talk about Part B, and it's certainly different, and we need to understand how it functions so we're comfortable with what we have. So when we talk about Part B covers what's considered outpatient services. So Part A covers inpatient services in the hospital, stuff that goes on in the hospital. Part B covers outpatient stuff that goes on outside of the hospital, whether it's a doctor's office visit or a specialist visit or outpatient surgery. That's all under Part B. So we need to understand that Part A is inpatient stuff in the hospital. Part B is outside the hospital. So not too complicated to figure that out and understand. And it doesn't really come into play all that much to need to know exactly what it covers, because you're just going to give them your Medicare card when you get there anyway. But let's understand Part B and how much it costs and what out-of-pocket expenses there are. So you can see here, the standard Part B premium is $134 a month. So when you come into Medicare, you're likely going to pay $134 a month for your Part B. It's not too bad compared to what you might have been paying for your health insurance up to now. Now, if you are currently drawing Social Security, they will take that out of your Social Security check. So they do it automatically. They'll take it out of your Social Security check. If you are not yet drawing Social Security, they're going to send you a bill. And they're going to bill you quarterly. So you need to understand that for sure, that you're going to be paying 3 months at a time for your Part B. So you got to manage that payment as it comes quarterly. So important to understand how you're going to pay for the Medicare Part B. And I'm going to show you in just a minute. You might pay more than that, and you might pay a lot more than that. And it's based on income and how they look at the income. And then I'll also show you how to appeal it if you think that you're paying too much. And I'll show you, I'll kind of run through that real quick. And I have all the forms for you. I'll show you where to get them and how to do it and all that stuff. So let's look at what the coverage is on Part B and what your out-of-pocket expenses are. So Part B covers, outside of what Part A covers, so it's the outside the hospital stuff, it pretty much covers 80%. So it has a deductible first. So you're going to pay the first $183. That's the 2018 deductible. It usually changes a little bit each year, but not usually a lot, but a little bit. And then it's going to be pretty much 80-20. So Medicare is going to pay 80%. You're going to be responsible for 20%. Now, the problem with that, I mean, it sounds pretty good, 80-20 coverage, not so bad. The problem is the 20 has no stop to it. So, you know, if you have a $1,000 year, no problem. You're going to have a $200 out-of-pocket expense. If you have a $10,000 year, you're going to have a $2,000 out-of-pocket expense. The problem is if something serious comes along and you have a $100,000 year, then you got a $20,000 out-of-pocket expense. Or God forbid, and it certainly does happen, you have a $1 million year, you're going to have a $200,000 out-of-pocket expense. So for the most part, when you have Medicare A and Medicare B, most people generally get a Medicare supplement that covers what A and B do not. So you have a much lower out-of-pocket. So for instance, if you had a Plan G Medicare supplement, your only out-of-pocket would be the deductible on Part B, $183. It would cover the 20%. It would cover the hospital deductible, so forth and so on. So certainly important to understand. And that's what I do. I help people figure out their Medicare choices. I'm an insurance broker. I do not work for any insurance company. I work on your behalf, and I help you make sure that we get it right from the start. So I would certainly appreciate it if you'd allow me to help you. That's how I make my living. There's no cost to you for using me to help you. And whatever insurance carrier we do choose, they pay me to act as your service agent. So it works out great for everybody involved, and make sure that you get exactly what you want to get when you come into Medicare. So this is the Part B premium chart. So if you make less than $85,000 single or $170,000 joint married, you're going to pay the $134 a month. So that's not a very high bar. So if you make more than that, you can see on this chart, it goes all the way to $428 a month if you make more than $160,000 filing as single or more than $320,000 filing joint. And where they look at this information is 2 years ago. So if we're sitting in 2018, they're looking at income from 2016 because you haven't filed your taxes. It's not in place for sooner than that. So if you made higher than 85,000 or 170,000 joint 2 years ago, this is what you're going to pay for your Part B premiums. And you can see it can fluctuate some, so it changes year to year, but usually not a whole lot also. But you have the potential to pay more than 3 times to get to the $428 a month than what some other folks pay. So you want to make sure you understand this completely. And a lot of times people made income 2 years ago that they are not making now. And if that is the case, you can appeal this. And this is called IRMA, is what the term is for their additional premiums. And I have all this stuff in the guides and forms on MedicareOnVideo.com. I'll show you that in just a minute. But you can get the brochure that talks about how to appeal your IRMA premium. And I also have the form there for you to be able to easily fill it out and submit it to make that appeal, and hopefully they can lower your Part B premium if that is the situation you are in. So make sure you certainly visit. And then I also have this, which is your Medicare benefits. If you want to dig deep into what A and B cover specifically, like how many pints of blood, or what do they do for an ambulance, or things of that nature, it's pretty much regular health insurance. So stuff that's medically necessary pretty much falls into it. But there are some specialty type scenarios that people need a little more information. So you can get this guide as well in my guides and forms. And this stuff, all you can just download it and it'll be on your computer. You can have it now. You can keep it for later whenever you need it. So just visit MedicareOnVideo.com. I've got a lot of great information here that you might need now or you might need in the future. So just kind of keep an eye on it and know how to get back to it when you need it. But you can see right in the middle, you can get an immediate quote on your Medicare supplement insurance. And again, that's primarily what I do, is help you figure that out. Find the right plan with the right company in your zip code for the right price. And it's certainly important, again, to get it right the first time, because we got an open window when you come into Medicare where we can pick anything we want and they can't say no. Once we're in Medicare, it's different. You have to then go through medical underwriting and be approved now. So we want to get exactly what we want and put it in place where we want it. So while you're there, you can also get a discount prescription drug card for free. Just click on that discount prescription drug card on top. It'll download on your computer and it will save you some dollars on your prescription drugs. So feel free to make sure you get a copy of that. Visit the Resource Center so you can find my videos here. You can also find the guides and the forms that I'm talking about, where I have lots of information that you can get on just about any piece of Medicare. And this is where you can get all those IRMA forms. So you can get the how to appeal, you can get the appeal form. You can also get an employer coverage form. If you are still working and you're going to retire past 65, they're going to need you to have this form filled out by your employer so you don't have a penalty on your Part B. So if you're going to retire in the next 6 months, get this form now, get it to your HR department for them to fill out so that you can give it to Social Security when you're going to sign up for Medicare. That way you won't have a penalty on your Part B. So very important to have. You could also get a copy of my book. I have a book called Medicare Made Clear, which pretty much covers every piece of Medicare. So whether you need it now or whether you might need it in the future, great to have on your computer or your iPad, and you can reference it whenever you need it. So make sure you download a copy of my book, and that will certainly help you as you go. If you want to see more of my videos, the best place is on YouTube, and try to make it easy for you to get there. If you go to www.keithvideos.com, it's going to take you right to my YouTube channel, and you can search through. You can see right now I just recently hit over 8,000 subscribers, so please subscribe when you're there. That way you'll always have access to my videos. But that's pretty exciting to have that many subscribers for what basically is an insurance guy trying to help people with Medicare. And if you need specific video information, just use the magnifying glass as a search. Put whatever topic you want, and it'll bring up the videos that relate to that topic. Part A, Part B, drug plans, supplements, whatever it may be, it'll bring up the videos that relate to whatever subject it is you need. So I hope you found this helpful, and I'm certainly happy to help with any of it. So by all means, visit MedicareOnVideo.com, send me an email, give me a phone call. I'm happy to help with any of it, and what I can promise you is that we will make sure to get all your pieces in the right places. And then that way you don't ever have to think about health insurance again. It'll do exactly what it's supposed to do, and you'll have it right from the start. So I hope you found this helpful, and have a fantastic day.